Good afternoon. This is Chuck from um, this is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you so much. Today is Monday, and every Monday about this time, we're coming a little bit early. But about this neighborhood, we normally host a 30 minutes clinic for our Believing for Baby mothers and fathers. So please happen to have around few minutes and you're in the group, please quickly join. And when you join, please introduce yourself and me your location. The clinic on Mondays is for special group of people that will become mothers and fathers in 2022. I'm actually hanging out with family in Orlando, in Florida, and it's an opportunity to catch up with the family and also a good opportunity to catch up with my family, which is Snowspirations Global Health Solutions. So in next 30 minutes, we will have an opportunity to ask your questions and I will give you feedbacks. So please, once you come in and you are able to see me, focus on my admin. Admin is gonna moderate and we are gonna have 30 minutes of question and answers. So I'm gonna look around and see who is in attendance. So all you need to do is to introduce yourself, focus on the admin, then start asking your questions. Okay, so you can actually start asking your questions immediately. Dr. Ndiche will also be helping me to provide feedbacks. So please, if you can see me, if you can hear me, can you give me a thumbs up? And once you are ready, please start asking your questions. The clinic is open. It's gonna run for 30 minutes. In the next 30 minutes, I'm gonna provide you feedbacks to your pertinent questions about how you can become a mother and a father in 2022. So please start asking your questions, okay? So I'm gonna quickly look around and I'll provide you feedbacks, okay? The operating officer will be on leave, so Kenna is not in attendance. She is on her yearly leave. But the two admins and Ebenezer will be in attendance. So please start asking your questions immediately and I'll provide you feedbacks. Okay, so I'm gonna look for questions and we're gonna have fun. Okay? All right, guys, start asking questions, please. It's Believing for Baby Open Clinic. It's gonna run for 30 minutes. I hope we are practicing our praying. I hope we are playing. Play every 48 hours. Playing means make love with your partner 48 hours. The fastest way of becoming a mother in 2022 is to practice PPP. The first P, we do a lot, we pray a lot, we believe in God. The second P, maybe to some people, but please make love 48 hourly. So if you made love yesterday, you can have a break today. Tomorrow you continue. You can have a break the next day. You continue 48 hourly. If you do this conscientiously, you will become a mother in 2022, okay? But right now it's time for questions and I'm searching for questions and I don't have a question yet. Please ask your questions right about now. Please ask your questions right about now. It's open clinic. It's open clinic. Okay? If you need to subscribe, follow admin. Okay. All right, let's see. Okay. Let me see what I have. Hold on. Excuse me. Okay, I'm searching for questions. Okay, let's see. All right. Okay, Doc, you're from Kefi. You are always specifying the order of sperm in your pants. Hope it's safe. Well, I'm confused. I don't know what you mean by that. You are perceiving the order. So, couple of things. When you perceive odor, it means your nostrils. So I don't understand that. Sperm doesn't really have an odor, okay? Just like your vaginal discharge, it's not supposed to have an odor. If your vaginal discharge, it's smelly. If your partner's sperm, it's smelly, then there's a problem. Okay, so if you're perceiving odor and you think it's coming from the sperm, that's very unusual. So what I will advise you to do, if you've noticed this, alert your partner. Make sure your partner sees a doctor immediately. It's completely unusual for sperm to have odor. Just the same way it's unusual for you to have vaginal discharge with odor. You can have vaginal discharge as a woman. Every woman has physiologic discharge. That's the way the vagina, the cervix, and the womb cleans itself. But it begins to become a problem when it's colored and it's smelly. That means you might likely have an infection, or you might likely have an inflammation or an allergy. So ordinarily, your sperm is not supposed to smell. So I will advise you, you ask your partner to go to the hospital immediately, okay? All right, let's see what we have. Please ask your questions. It's open clinic. I don't have a topic. I'm just gonna be providing you feedbacks. Okay, let's see. Doc, after doing hysteroscope is a special investigational diagnosis. So diagnosis means we are checking something. Hysteroscope is a special test we use in checking your womb. Anywhere you see hystero is referring to your womb. So let me see. During hysteroscope, where can the person conceive? As in, does it take months? Now, my sister, your hysteroscope has nothing to do with your conception. Your hysteroscope is just an investigation we use in checking your womb. Now, in some situations, when we are doing hysteroscope, if we discover anything abnormal, we can remove it. Anytime we remove anything from the body, we send it for histology. So hysteroscope has nothing to do with your conception. If we entered your womb and we noticed you have adhesions or fibroid, the next thing to do is to correct the adhesions and correct the fibroids. The hysteroscope has nothing to do with your conception. So long as you are okay and you are ovulating, you can become pregnant. Okay, so your hysteroscope, once you recover from the uncomfortable feeling, continue making love with your partner. That's the recommendation, okay? All right, let's continue, guys. Please, when you come in, start asking your questions. The clinic is open. Is it good for someone who has been diagnosed with hemorrhagic cyst, to use fertility drugs? So here is the deal. In the first place, the only person allowed to give you fertility drugs is who? A fertility specialist. Now, hemorrhagic cyst simply means you have a blood-tinged content in either the ovaries. Most hemorrhagic cysts will happen in your ovaries. So ovarian hemorrhagic cyst, thankfully, they might not affect your ability to become pregnant. So here is the deal. The only person that should give you drugs for fertility is a fertility specialist. So you don't make mistakes of abusing drugs. So on its own merit, it's completely unacceptable to take any fertility drug, including your popular Clomid. You should not take any fertility drugs unless your fertility doctor prescribed it. Let me give you an example. Orlando is a little bit hot, so that's why I'm sweating. So here's the deal. If you have a need for Clomid, most fertility specialists will give you Clomid for 5 days. It's called Clomid Challenge. The function of Clomid is to challenge your ovaries to release the eggs. So some women might have ovarian problems, which will prevent the eggs from being released. You already have your eggs, but for some reasons, they are not being released. So in that situation, if we confirm you have ovulation problems, we can give you Clomid. Clomid is an example of ovulation induction drug. When we give you Clomid, We will monitor you for 5 days. If you respond better, you're going to release your eggs and the sperm will meet your eggs. So if you don't have a need for fertility drug, you don't take them. Taking fertility drug without oversight and monitoring and instruction from your doctor will not help you. It will harm you, okay? So if you're currently taking Clomid without prescription, you are not helping yourself, okay? Okay, let's continue, guys. We have about 15 more minutes, so you have 15 more minutes to ask your questions, okay? Let's see. For how long will it take a woman to get pregnant after fibroid surgery? So here is the deal. You have to recover fully. Anytime you've had surgery, you have to recover from the physical wound, from the surgery. So the surgical removal of your fibroid is called myomectomy. So you need to go back to the surgeon that performed the surgery. We will monitor and make sure you are fully recovered in the wound. Then you are recovered emotionally. You are recovered psychologically before we can tell you to start trying. Now, if the type of fibroid you removed is the type that can affect your fertility, you will improve your fertility. Anytime you're going for fibroid surgery, make sure you have a specialist doing it. They will conduct what we call fertility sparing myomectomy. Fertility sparing myomectomy means they will be careful to make sure they don't damage any of your reproductive organs. They don't damage the vagina, they don't damage the cervix, they don't damage the womb, they don't damage the ovaries, they don't damage the tubes. Once you are recovered, you can start trying to become pregnant again. But please, make sure you seek help from the surgeon before you resume lovemaking. Why? When you make love in a freshly operated wound, you can infect the womb. You can infect the cervix. So you need to recover. The same thing is applicable to newly delivered mothers. Before you engage in sexual intercourse, make sure your doctor gives you a clean bill. Make sure you're recovered. Some women will have episiotomy. Some women will have vaginal tear following birth. You have to recover. Anytime you have a wound in your vaginal area, if you make love, you can infect that wound. Any opening in the vagina can have an entrance for bacterial, viral, and fungal infection. Okay, so you need to be careful. All right, let's see. Okay. Orlando is always hot. So hold on, let's see. Doc, will you have any problem giving birth via the vagina? Constantly making love with your husband while pregnant. So here's the deal. Whether you're making love during pregnancy or you're not making love, it's not going to affect how you're going to have your baby. So long as you don't have any indication for CS, you're going to have your baby vaginally. Matter of fact, if you don't have any issues, so there are some women that will not be allowed to make love during their pregnancy. If you are bleeding, if you are having water come out from your vagina, or you have pain, then you are exempted from love making. But if you don't have problems, you are allowed to make love through your pregnancy. So whether you're making love or you're not making love, the criteria for delivering to the vagina is the progress of pregnancy, is the presentation of your baby. If your baby is presenting with head and you have adequate pelvis, that means your vaginal area and the pelvis can deliver your baby. Your baby's head is not too big for the pelvis. You can have your baby vaginally. So whether you're making love with your partner or not, it's not going to affect the method of delivery. The only time we will allow you to deliver vaginally is if the vaginal delivery is allowed. Some women might not be able to deliver to the vagina based on certain indices. If you have had your baby in the past through CS, the possibility that subsequent deliveries will be CS is high. However, some women can still have vaginal delivery, even if they've had CS delivery in the past. But your doctor will be the person that will determine if you're going to have vaginal delivery or cesarean section delivery. But it doesn't matter how you have your baby. The most important thing is that you're going to have your baby. Okay? Let's continue. Make sure you register for the ovulation and pregnancy bootcamp. The last Sunday of this month, we are going to discuss everything about ovulation. Now remember, if you don't ovulate, you cannot become pregnant. Just like you cannot become pregnant without sperm. So the two cells that must be ready, that must be present before you can become pregnant is what? The sperm and the egg. The process of releasing the egg is simply what ovulation is all about. So if you know you have problems, if you know you don't have to calculate your ovulation, or they told you you have ovulation problems, please register for the boot camp. We are going to help you to understand it better. This is a class you don't want to miss, because without ovulation, you cannot become pregnant. So without releasing your eggs, whether you're having the baby naturally, whether you're going for IUI, whether you're going for IVF, whether you're going for surrogacy, whether you're going for adoption, every singular means of becoming a mother must have the egg and the sperm involved. Okay, let's continue, guys. All right, ask your questions. And Dr. Ndiche is also providing you feedbacks. Remember, if you are already pregnant, please register with our ANC crew in Telegram. If someone is pregnant, at what month will the person start having sex? It doesn't matter. Anytime you want to have sex in your pregnancy, you can have sex. So long as you don't have complications, so long as you're not bleeding, so long as you don't have pain, so long as you don't have premature rupture of your water membrane, you can have sex. There is no indication for not having sex in first trimester, in second trimester, in third trimester. So you can have as many times of sex you want to have. There is no way your baby is going to be affected. The only time we tell you not to have sex is when you are bleeding. So once you notice blood, be it spotting, be it you white, you saw blood, or you're bleeding frankly, is a danger sign. There is no bleeding once you are pregnant. So once you notice bleeding, there are 3 S's. Admin, capture this. 3 S's you must observe. Number 1, no sex. Number 2, no sports. Number 3, no stress. Sex, sports, stress. When you stress yourself, you might likely have early delivery of your baby. When you engage in sex, when you are bleeding, you can complicate a lot of things. When you are in sports, you can complicate a lot of things. So these are the 3 things you must avoid, okay? But apart from that, some women notice they have increase in libido during pregnancy, and some women notice decrease in libido. So people are wired differently. Pregnancy affects people differently. So if you don't have any problems in your pregnancy, continue making love with your partner. Matter of fact, it helps in creating bonding between couples and intimacy. But your baby is safely developing in your womb without any problem. Okay? Okay, let's quickly wrap up. We have about 6 more minutes. We don't have any location outside Nigeria, okay? Okay, let's see. Okay, any hope for having a baby at almost 49 years? You have 2 failed IVFs. Yes, any woman at any time, at any age can become a mother. But how you become a mother matters. Now, my sister, at 49, the possibility you've gone into menopause is high. Can you still become pregnant? Yes. What do you need if you're going for another IVF, which I will recommend? So I want you to go for another IVF. But guess what? You will need donor eggs, and possibly you will need donor sperm. At 49, you can become pregnant. Matter of fact, at 49, you can even have twins. You can even have triplets. You can even have quadruplets. But the criteria is, what's the quality of the eggs? The possibility you have gone into menopause at 49 is high. Now, if you haven't gone into menopause, the possibility you don't have good ovarian reserve at 49, it's high. So what we do in our group, once you are 40 and you are planning to go for IVF, first of all, we will conduct your ovarian reserve. And what we normally advise our members to do is to do what? To use donor eggs. You have a better chance of having good outcome when you use donor eggs if you're in your 40s, because at 40s, you have both reduction in the quantity and quality of your eggs. So yes, my sister, you still need to go for another IVF, but you will need donor eggs and possibly donor sperm. Now, if you want to genuinely start your family, you can start the process of adoption while you're preparing to go for another IVF. You can also start the process of surrogacy if you have the money. So you can have a blended family, okay? Okay, guys, I have 4 minutes. 4 minutes and I'll go. Okay. Please, if you need help, ask admin. Admin is going to help you. You're 43. Your period is irregular. It's always season, no ovulation. So it's possible, my sister, that you have poor ovarian reserve. It's even possible you've gone into menopause, okay? One of the indications of menopause is irregular period, increase in vaginal dryness, low interest in sex, and, hotness, hot flushes, okay? Now, if you haven't had your bleeding for 12 consecutive months, number one, if you noticed that you recently started experiencing dry vagina, you don't have interest in sex, and you have hot flushes, and it's 12 months you haven't bled, you need to go to a gynecologist. We need to confirm you've gone into menopause. When you get to the gynecologist, we are going to check your FSH. We are going to check your AMH. Your FSH is follicular stimulating hormone. Your AMH is anti-Mullerian hormone. Now, these two hormones are going to tell us if you've gone into menopause. Unfortunately, if you have gone into menopause, you no longer have eggs. So you can no longer become pregnant without eggs. What you need is donor eggs, okay? So any woman that goes into menopause before 40 is called premature menopause or premature ovarian failure. Okay, guys, let's actually wrap up. I have 3 more minutes. 3 more minutes. Okay, let's see what we have. Okay, let's see. Doc, what causes discharge of water after sex in menopausal age? So here's the deal. What you call water is physiologic fluid. Every woman discharges, especially during sexual intercourse. Matter of fact, some women that have high libido and experience orgasms will have what we call squirting. Okay? So anytime in course of sexual intercourse, you notice fluid or water or what looks like water or urine coming out from your vagina, it's not a problem. It's part of the sexual pathway. Some women can experience this. Now, in your menopausal age, the fact you're engaging in sex is actually a good thing because part of the presentation of menopause is dry vagina. So you can get some lubricants. Okay, so long as that discharge is not blood, it's not greenish, it's not yellowish, it's not smelly, it's not copious, it's completely okay. You are supposed to have discharge as a woman. That's how your body cleans itself. So it's expected, okay? Guys, I will attend to one more question, then I'm done for the day, okay? All right, let's see what we have. Okay, this particular question is very important. What causes headache during your period? So here's the deal. During your period, there are a couple of hormonal changes. There will be hormonal changing, progesterone, estrogen, and a couple of other hormones. Now, your progesterone is a hormone we've noticed that can also change some pathways. So in some women, when they are bleeding, they normally have a lot of what we call premenstrual syndrome. So headache might be part of it. So here's the deal. If you've always had headache during your bleeding, it's your normal. What you need to do is to be in a calm environment and take your paracetamol and you're okay. So there is completely nothing to worry about. what you're having is what we call PMS, premenstrual syndrome. And in some women, it can present with headaches. Okay, so thank you for coming. Later this evening, when I'm back to my base, we are gonna talk to our members in YouTube. So keep an eye on our YouTube live, somewhere around 7 or 8 p.m. my time. Thank you for coming. If you need help, please subscribe. Remember, you cannot be a believing for baby mother in 2022. You will have your babies. You will have your boys. You will have your girls. You will have your twins. You will have your triplets. It will happen. So, but please, if you don't have plan today. If you are not planning, then you are planning to fail. Remember to pray. Remember to play and practice. I love you guys, and God bless you, and bye-bye for now.